Thank you for joining us for Ask a Therapist, the Blue Cross Blue Shield of South Carolina series, in which we speak with mental health professionals about issues many people face every day. I'm one of your hosts, Brindy McNair, and today we're joined by Prisma Health psychiatrist Dr. Ashley Blackmon Jones to talk about maternal mental health. Thank you for joining us. We've talked a lot about pregnant women or women who've just given birth, but what about mothers of older children? How can they best manage their mental health?
I think parenting has its challenges no matter how old the child is. I would again encourage a supportive network or this social connectedness to others. Often, parenting feels like an isolating experience, and obtaining support and validation from other parents can be really valuable. From an anthropology perspective, if you looked back, hundreds and hundreds and hundreds of years, parenting was very much a community experience. And I think over time, especially here, it's become quite isolating for people. So I think that social connectedness is really important. The virtual platform has actually been a good way for parents to increase their ability to connect with others, whether it's local parent groups or online support groups. And again, therapy is another way to increase support and develop ways to manage stress. And I'm just a big proponent of psychotherapy for everybody.
But there is some stigma around mental health. What are some specific stigmas around maternal mental health that might keep people from seeking help? And how can they overcome these stigmas?
I think there's stigma around mental health in general. So some of those barriers are still present with maternal mental health. But in addition to that, I think some environments perpetuate the idea that pregnancy is always a time of feeling wonderful and glowing. And it makes women feel like it's not okay to not feel okay. There's pressures of motherhood, role changes, and sometimes it can be that overwhelming and isolating experience. I often see mothers where mental health was not discussed by their family or by their peers. Sometimes people just don't talk openly about it. I think it can be quite validating when mothers are able to hear that these illnesses occur. They're more common than they think. There are other people who have had this same experience and that there are treatment options available. And I think it's also important for healthcare systems as a whole to examine potential areas of concern, disparity, discrimination, or bias when it comes to the care that they provide, because I think those are additional barriers that may cause people not to seek treatment.
Are there any resources out there for moms who need help managing their mental health?
I would say the first step in accessing resources are through the primary care physician or the OBGYN, especially if referrals are needed. People can check with their insurance company for a list of psychiatrists or therapists. Typically, there's online resources available for counseling or therapy. In fact, there's a website called psychologytoday.com where therapists can participate in a database, and the mother can narrow the search to their zip code, their insurances, service that they're seeking, and actually read bios about the different therapists to see somebody that they might want to see. There's also online resources like apps or a website called Postpartum Support International, or PSI. And PSI has online groups and lots of different resources for partners, for grief, and also includes Spanish versions of the website. There are telehealth programs specifically related to perinatal psychiatry services in South Carolina, and several programs specific to that in the larger cities in the state.
So, you mentioned having that support system in place. How can friends and family members recognize if someone is experiencing a mental health issue or crisis? And what's the best way to respond?
I would say first listen and observe as much as possible. When someone's having a mental health crisis, it's important to engage treatment as quickly as possible if it's a crisis. I tell folks to monitor for severe and concerning symptoms like statements about no longer wanting to live, thoughts that they're a burden to others, thoughts of harming themselves or others, including the baby, or actively having hallucinations or really bizarre behaviors or confusion. In those instances, it's important to access care as quickly as possible because I would consider those emergency situations. Options for accessing care in that instance would include the emergency room or contacting 911. South Carolina, in certain areas, also has mobile crisis teams, and the local mental health centers have emergency walk in triage services during business hours. The police do welfare checks, or patients can go into the emergency room. Many areas also have partial hospitalizations or day treatment programs where the mom can go during the day but is able to go home and stay at home at night. I think it's really important to ask enough questions to determine how severe the situation is and help if you can in the process of connecting someone with services and keeping them safe. South Carolina also has a mental health line number. So instead of 911, it's actually 988. And that's a specific mental health line number. So it's 988. But overall, validating a mother's experience and feelings and encouraging her to seek treatment options is really important. If the situation isn't an emergency, but someone's having symptoms or that noticeable change in behavior or their quality of life is affected due to symptoms, the options for initial steps in accessing treatment are contacting their OBGYN, their primary care physician, or if they already have a psychiatrist or a therapist, getting them involved and understanding what's been going on recently.
Why is it important to speak more openly about maternal health issues?
It's incredibly important to begin conversations about maternal mental health, not just with mothers and patients, but also with physicians and providers in the community so that they're asking, assessing, and opening the door to help mothers talk about their experiences and obtain treatment. I think the more information that's made available, the more people begin to understand and they begin to talk more openly about it. And then they begin to seek treatments for mental illness during pregnancy and postpartum. I also think advocacy is an important component, and that includes communicating to our representatives and policymakers about policies related to things like parental leave, cost coverage of services, equitable access to services and healthcare and decreasing healthcare disparities, funding for maternal health programs that include substance use and mental health, affordable daycare options, just to name a few things. But I think sometimes talking about those lends people to more action and wanting to have more services available for mothers.
Thank you so much for joining us today, Dr. Jones. This is great information for moms who may be struggling with their mental health. We hope this discussion can help you or someone you know. Blue Cross Blue Shield of South Carolina members can call the number on the back of their insurance card for mental health resources. We hope you'll join us again for our next Ask a Therapist discussion.